We're here with our lovely patient who we did your brachioplasty with the liposuction yesterday, right?
Correct.
How was last night for you?
It was easy.
It was
No
easy?
problems.
You look like $1,000,000 today. I'm assuming you're sore to some extent.
A little bit, but nothing.
Nothing crazy.
Yeah.
If you wouldn't mind, I'm gonna just kind of show you off a little bit. I think you have an amazing result. I'm really excited for you. But let me just kind of demonstrate some things. First, what you'll notice, there's a little bit of swelling associated with the inflammatory response after surgery. But everything is sort of in proportion, looks just the way you want. The upper arm and the lower arm kind of match. That's super important. We want everything's in proportion. If I lift you up like this, we've gotten great lift in the arm. It continues into the armpit. That's also super important. We've got a little bit of bruising that's showing up sort of near the elbow. That's pretty common. And sometimes we can get a little bit of an indentation from the way that the arm bends. So that is something that we want to keep an eye on, and we want to massage if it gets to be like too deep, okay? Otherwise, this is the Pico dressing. That's gonna stay on for a week. It then comes off, and then we either reapply another Pico or we use steri strips, which are like medical masking tape,
Okay.
right?
Yes.
This is the little box for the Pico, and that guy is gonna be flashing green and just doing its job while you heal. But I love your results.
so
I
great.
can't wait.
I'm so excited.
I'm really happy that I see. Are you happy?
Yes, very
You're
much
happy.
so.
All right,
Amazing.
wonderful.
Thank you.
If you wouldn't mind kind of explaining what yesterday was like and then this morning, because you're just a few hours
Okay.
since you left this place,
So
right?
we did this procedure awake
Mm-hmm.
and gave some pain pills before we started, and then marked everything up. And then the injections to numb really were not any worse than if you had a blood drop. And I felt a couple of those.
Right.
And then after the first one or two, then I didn't feel any of the others that you
Things were pretty numb, right?
Yeah, right.
Yeah.
So then during the procedure, once you were doing all of the lipo, I could feel it moving around, but it was not anything uncomfortable, definitely no pain. We sat up in the middle,
That's right.
did some arm movement so that you
Yeah.
could adjust.
So that we could try and get
Yeah.
things symmetric.
Right.
One of the other things that I tried to do with the liposuction was to try and create a little bit more of like the shoulder definition. When your arms were down at your side, there was some volume that sort of poked out a little bit. And so we did some liposuction that took down the area right here. And so that's when you're
Sure.
talking about the sitting up and checking things, that was part of what we were looking for
Right.
as well.
So then we did that, then we took a break
Yep.
after the liposuction, and that view was amazing.
Right?
Just the skin and what it was going to look like, I was so excited. Had a snack,
Yeah.
and then what did we do? Oh, then you dropped off the flap.
That's right, then we got rid of the thing. Yeah, and you know, I'll tell you that that moment between the liposuction and the brachioplasty is a time when I start getting pretty excited. You know, when you're talking about like you sat up and you like
Sure.
look at that, and it's pretty shocking, right?
Right.
Because you can start to see the shape of the arm underneath. Anyway,
Yeah,
I
it was
find
great.
that a lot of fun.
We had a lot of fun.
We did have a lot of
We
fun.
talked about everything under the sun, probably
Yeah.
by saying some music, little
That's
little
right.
surgical bed karaoke.
Yeah.
So good times.
It was. I really enjoyed working with you. I couldn't be more excited.
Thank you.
You are lovely. I'm
Thank you.
really excited to just like let you have something really special.
And
So,
then recovery last night was easy. We were at the hotel. The bandages that you wrapped to collect things did their job. Didn't make a mess on anything.
you leak though, right?
Yeah, it was a lot, but it wasn't anything super scary. And then pain-wise, I just stayed up on the pain pills, slept most of the day, and then I haven't had any pain pills since about 1 in the morning.
That's
I'm
great.
totally fine.
That's great.
I mean, it may be a 1 out of 10 right now.
That's awesome. Yeah, and you know what? That's what we would expect. But I will say, I don't know. What do you think made this like? How did you prepare? Because you're doing so well. Like, what would you recommend for someone who's considering doing this?
Well, I watched your YouTube a lot. Saw what the procedure was going to be because everyone freaks out about the whole awake idea.
Yeah.
So I was prepared for that mentally. I have a very active job with my arm, so just tried to get that arm muscle as much as I wanted to. Lost the weight that I wanted to lose
Right.
for the arms
Okay.
to get to that point. I mean, granted, I would still like to lose more, but you know how that goes. And then just, I don't know, just being mentally excited
Yeah.
and ready to do it.
I think you were. You were excited, and that was fun
Yeah.
for me. So, all right. Well, I'm gonna give you a really gentle hug.
All right, thank you.
It was really nice working with you,
I
and now
appreciate
we
it.
just gotta get you to heal up.
All right, awesome.
All right.
Thank you.
Thanks so much.
Bye.